Hey everyone, welcome back. In this quick lecture, we're going to go over something that looks kind of dramatic, but it's actually totally benign, and that's oral pyogenic granuloma. It's a pretty common soft tissue lesion, and today we're going to go through what causes it, how it looks clinically, and how we usually treat it. All right, so pyogenic granuloma, it's actually not infectious, and it's not a real granuloma either. It's what we call a reactive lesion, meaning it forms in response to local irritation, trauma, or like some chronic inflammation. Most commonly, we see it on the gingiva, but you can also find it on the lips, tongue, buccal mucosa, or even the palate sometimes. Clinically, it shows up as this red or reddish purple soft tissue mass. It's usually smooth or lobulated, and it might be pedunculated or sessile. One thing that really stands out is how fragile it is. Like, it bleeds really easily. Patients will say it bleeds when brushing or eating. And even though it's called pyogenic, there's no pus. Histologically, it's just like granulation tissue, so a bunch of tiny blood vessels in a loose stroma vascular. Now, the main triggers, we're talking plaque, calculus, overhanging restorations, poor fitting appliances, or like even too much brushing. And hormones play a big role too. So during pregnancy, for example, you might see what's called a pregnancy tumor or granuloma gravidarum. Those usually show up in the second or third trimester and like often shrink on their own after delivery. It's more common in younger people, especially females. And when it's on the gums, it's usually in the front, more labial than lingual. Diagnosis is mostly clinical, but biopsy is still the gold standard, especially if the lesion looks weird or keeps coming back. You need to rule out things like peripheral ossifying fibroma, peripheral giant cell granuloma, or even rare stuff like Kaposi's sarcoma if the patient's immunocompromised. As for treatment, we usually go with surgical excision, but, and this is important, you've got to eliminate the source of irritation or it's just going to come back. In pregnancy cases, if the lesion's not causing trouble, we might just wait until after birth. But if it's bleeding a lot or getting in the way of like eating or speaking, removal during the second trimester is generally okay. Recurrence is possible if the irritant isn't removed, but if you do a clean excision and manage the cause, prognosis is great. It's benign, no risk of cancer, and laser excision is also an option if you want better bleeding control and less discomfort. So yeah, that's a solid overview of pyogenic granuloma, reactive, vascular, and very manageable if you know what you're dealing with. Thanks for tuning in, and I'll see you in the next lecture.